morning, students. I'm Mrs. Janet Sintim Abuaje, lecturer at Christian Service University College. Today, our topic is Partograph, and my objectives are, by the end of the lesson, students will be able to define Partograph, mention the part of Partograph, describe at least 2 parts of Partograph, plot Partograph for a client on admission, identify prolonged labor. What is Partograph? It is a graphical representation for assessing the progress of labor, or is a managerial tool for managing the process of labor. It is also a tool that can be used by a midwife to assess the progress of labor and to identify when intervention is necessary. There are some importance of Partograph. These are some of the importance. It gives a complete picture of condition of the mother, fetus, and progress of labor. Provides guidelines on when labor is no longer normal and on management for those situations. It helps to prevent prolonged labor. That is, when labor is more than 8 hours, it will enable the midwife to know so that clients can be referred. It serves as a handing over tool. When a midwife comes on duty and he uses Partograph, when another midwife comes for her to hand over, because it has been documented, he just read through it, go through it, how he cared for the client. Everything is written and plotted on the Partograph, so it can be used for the next midwife also to continue. It helps us to know when referrals should be made. When a client is having problem, after using Partograph, it will enable the midwife to know that the client is having problem. So with this one, if the person is at the periphery, she just quickly refer the client. It indicates when to take action and augment labor. When the contraction is weak, the midwife easily sets IV fluid, add pitocin to stimulate contraction. It helps to know the conditions of both mother and baby with the monitoring. When the fetal heartbeat is checked and there is fetal distress, it will enable the midwife to know. And also, when the mother is having distress, the BP will change, the fetal heartbeat will change, the maternal pulse will also change. It will be abnormal, and this will enable the mother, this will enable the midwife also to know that there's problem with the mother and the fetus for them to be transferred. It also improves maternal satisfaction with labor by ensuring companionship in labor. Because the Partograph is being used every 30 minutes, contraction is being checked every 4 hourly. The dilatation, descent is also checked. Fetal heartbeat is checked 30 minutes. Because of all this, every 30 minutes, the midwife is supposed to be with the clients and check all these things. So it will bring about good relationship between the midwife and the client. Research and legal documents. We can also use it as research. When students need information, they can go to labor ward with the Partograph being checked. They can use some for their research. And if there is any problem, legal problem, because it has been plotted and kept, they can easily assess and use it as legal document. These are the parts of the Partograph: demographic data of patients, fetal condition, progress of labor, maternal condition. Demographic data of patient: registration number, name, that is last and first name. Age, the age of the client, the date that the client reported. Gravida, number of pregnancy, and para, the number of deliveries that the mother has had. Then last menstrual period, and then expected date of delivery. It also comprises of the gestational period, rupture of membranes, the tire membrane was ruptured, and the dates. The labor duration, how many hours have the client spent since labor started. Facility, that is the hospital that the patient or the client has reported, the name of the facility. Measuring fetal well-being during labor. You are supposed to measure the fetal heart rate and pattern, the degree of molding and caput, whether normal or abnormal, the color of amniotic fluid. The fetal heart rate record every half hourly, and it should range between 120 and 160 beats per minute. That is the normal fetal heart rate. The amniotic fluid, record the color at every vaginal examination. If membranes is intact, we use or we plot I. If membranes is ruptured and is clear, the fluid is clear, we use C. If membrane is ruptured with meconium, we use M. If there is blood stain fluid, we use B. If there is no fluid at all, we use A. Molding of the fetal scar, we use O for sutures opposed or separated, and sutures can be felt easily. We also use 1+, which means sutures overlapped but reducible. ++, we use ++, sutures overlapped and not reducible. +++, that is 3+, bones are overlapping severely. The maternal condition. The maternal condition involves vital signs, that is the pulse, we use dot. Then temperature, we write the temperature checked in a box. Blood pressure, it is also indicated in the box. Then urine output, the amount of urine the patient passed should be recorded. The ketones and protein should also be recorded. Either you use negative if there is no ketones nor protein, we use negative for that. But if there is ketone and protein, we use 1+. Depending upon the amount, it has to be increased with ++++. The maternal condition also involves oxytocin, record amount per volume. Then IV fluids, drugs given should be recorded. Any additional drugs given should also be recorded. Now the progress of labor. This consists of cervical dilatation, descent of presenting parts, contractions. Now the cervical dilatation. The cervical dilatation comprises of latent and active phase, or we use latent and active phase. The latent phase is slow period of cervical dilatation, and it is from 0 to 4 centimeters dilatation, and it is accompanied by gradual shortening of the cervix. It should normally not last longer than 8 hours. Cervical dilatation continues with the following. The active phase, faster period of cervical dilatation, it is from 4 centimeters to 10 centimeters dilatation, with progress at 1 centimeter per hour and remains on or left of the alert line. The dilatation should be at the rate of 1 centimeter per hour. The dilatation of the cervix is plotted with an X. When labor progresses well, the dilatation should not cross to the right of the alert line. How do you manage latent and active phase? Use comfortable positions for labor and provide privacy. Reassure clients to allay her anxiety. Give the woman and family-friendly care. Explain what is happening to the woman after each evaluation. Teach the woman and birth support person how to support the woman in labor. That is the woman who is supposed to take care of when the woman is at home. You have to teach them how to support her. Encourage client to urinate every 2 hours. Clients should drink fluids at least every 1 hour or more often. Should eat light diet. Clients should drink fluids at least every 1 hour or more often. Clients should also eat light diet. Massage the woman's back as needed. Explain all procedure to her and help her feel comfortable. Give emotional support when necessary and educate her about what is happening. Encourage her with breathing exercise that can help the laboring woman relax and how not to push during crowning to allow for slow delivery of the baby's head. When I say crowning, it means this is where the head does not exceed contraction. When there's contraction, the head of the fetus will neither move back nor forward. Descent. Descent is assessed abdominally in fifth above the pelvic brim. The head is divided into 5 parts, palpable above the symphysis pubis. The anterior shoulder of the fetus and the symphysis pubis are used as landmarks. It starts from 5/5 up to 0/5. It is done before vaginal examination. Symbol for descent is 0. At 0/5, the sinciput, that is S, is at the level of the symphysis pubis. 5/5, it means completely above the symphysis pubis. 4/5, sinciput high, occiput easily felt. 3/5, sinciput easily felt, occiput felt. 2/5, sinciput felt, occiput just felt. 1/5, sinciput felt, occiput not felt. 0/5, none of head palpable. Uterine contraction. Contractions are observed for frequency and duration. The number of contractions in 10 minutes is recorded and it is down every half hour. Less than 20 seconds is plotted with dots. Between less than 20 seconds is plotted with dot in a box. Between 20 and 40 seconds is slides in a box, and above 40 seconds is deepened in a box. There's a question for you to answer using the Partograph sheet. Indications for starting the Partograph. For you to start Partograph, the following information should be well noted before you use your Partograph. These are labor mass correctly diagnosed. That is, for all women in whom vaginal delivery is anticipated, do not start for women going to have cesarean section. Do not start in advanced labor, that is 8 to 10 centimeters. Do not start when woman is not in labor or less than 4 centimeters. Initial assessment indicate immediate referral. Initial assessment indicate immediate referral. Disadvantages of the Partograph. labor requires regular monitoring. All data will be lost if a single sheet of paper is missing. That is, for you to use Partograph, it has to be done regularly. You have to continue. For you to use Partograph, labor requires regular monitoring. You are not supposed to monitor and then stop, but it has to be done continuously till the patient delivers. And like I said, all data will be lost if a single sheet of paper is missing. If you mix one paper, if you mix one paper, it means you have also lost your data. Summary. I gave you objective before starting. I want to know whether you have achieved your objective. I want to know whether my objectives have been achieved. So I will ask, I want to know whether I have achieved my objective in the form of summary. What is Partograph? Mention the part of Partograph you know. Describe at least 2 parts of Partograph. As a midwife, how would you plot Partograph for a client on admission? How would you recognize prolonged labor? My summary will be in the form of question. I want to know whether I have achieved my objective. What is Partograph? Mention the part of Partograph. Describe at least 2 parts of Partograph. As a midwife, how would you plot Partograph for a client on admission? How would you recognize prolonged labor? Thank you.